Welcome, everyone. We'll just get a few more minutes to let people show up for the webinar, and I want to thank everyone who was early and on time. So we can get started on the tech talk since, once this video is recorded, this part will probably be cut out of the recording. But welcome everyone to CPSC's webinar on textile regulations for hospitality and healthcare sectors. This meeting and this webinar will be recorded, and the recording and the slides will be available, publicly accessible on CPSC's YouTube. We'll send out a follow-up email to all the registrations, and we welcome all the questions you have as they arise. You can use the chat or the Q&A feature. We definitely recommend the Q&A feature so we can keep track and give multiple responses as needed. I encourage everyone to ask questions as they arise. We have multiple staff members to help moderate questions. If there are clarifying questions, I might interject so that the speaker could address the question in that moment. If they're discussion questions or apply to multiple speakers, we'll hold them till the end where we'll have at least 30 minutes for a Q&A. So once again, welcome everybody to our webinar. CPSC is excited to host. Our topic today is textile regulations for the hospitality and healthcare sector. We're really lucky to have three panelists and a message from our sponsor today. My name is Joanne Brasch. I'm Director of Advocacy for CPSC. The California Product Stewardship Council were the exclusive sponsors of SB 707, and we're excited to hold this webinar as an educational opportunity for specific covered products and markets that are impacted by the bill. With us today, we also have Erika Kimball, CEO and Principal Consultant for CSH, who has been active in healthcare sustainability for quite some time. We connected over a decade ago when I worked at UC Davis Healthcare System. So this collaboration is a decade in the works. But ultimately, she's going to share today some of the textile-specific projects that she's worked on in some of the Bay Area hospitals and to reduce their textile waste. We also have Scott Hamlin, founder and CEO of LoopedWorks, a recycler. Are lucky enough to have them on the West Coast. We have a blank screen, so I'm going to just double check to make sure that we're sharing accurately. Thank you for letting us know. Is everyone able to see the slides now? Wonderful. And Scott's going to tell us more about the services they offer as a recycler who can take in a lot of the healthcare and hospitality products, textile products in the waste stream. And we're very appreciative today to have Landbell Group and Pat Gibbs to give a little message to our audience and some background on why they're getting engaged with CPSC and the Textile EPR program. And as a reminder, this will be recorded, so please, if you have any confidential information, please keep it to yourself. SB 707, also known as the Responsible Textile Recovery Act, was a bill that was passed in 2024. Governor Newsom signed it in September. And since that moment, CPSC has been going on an education tour all over the country to make sure that the impacted stakeholders are very well aware of what this legislation does here in California and what the global impacts are for this EPR program. The last round of amendments came around August 22nd, 2024, so just a few weeks before the bill passed. And we were really lucky to set history in California. SB 707 was the first extended producer responsibility legislation to pass in California with 158 endorsements and 0 opposition on record. It's one of the largest extended producer responsibility programs in California, although we have 14 of these types of policies. So adding to the list and adding to the programs that are overseen by CalRecycle, SB 707 follows a lot of similar structure and content of other EPR bills. So we'll talk a little bit about that, what's in the bill and what it does. But we definitely want to take a moment and thank everyone who was engaged in the bill. You know, these are the organizations that endorsed it, but there were hundreds and hundreds of others who either stayed neutral or engaged in other ways through sharing the word, supporting some of the discussion. So we want to thank all the stakeholders, especially the opposition groups, because through their opposition and through their negotiation, we all came to a place where we were really proud of the bill, really proud of the contents, and how this piece of legislation will truly create and drive a circular economy with equity and access at its core. So since the bill passed in 2024, the department under the EPA that runs the program is called CalRecycle. CalRecycle held their first workshop in July 17th, and this is the kickoff of stakeholder engagement. It was the first of several what we call, workshops during the informal regulation process. We'll talk a little bit later about the difference of informal regulations versus formal regulations. But what's important to know right now in the informal process is it's the best time to engage with CalRecycle. They are answering questions live and giving feedback during the workshop. They're taking questions, they're taking meetings, and our next public workshop is going to be September 9th. So a good reminder that these meetings are hybrid. So they are accessible all over the world. If you need translation into Spanish, there's opportunities for that. But we do encourage people to come in person. I think there's a lot of energy behind this bill. And on July 17th, we almost filled the auditorium. And we want to do it again for every other hearing moving forward. So please, if you plan on coming to Sacramento on September 9th to be part of the workshop, please reach out to CPSC. We will try to arrange carpools. We can arrange a coffee meetup with everyone and ultimately give anyone the guidance they need to understand the bill and how to advocate for what they want. So the next workshop is going to be covering the topic of the PRO application. And we'll talk a little bit more about, the application and when it's due, but I do want to take a moment to explain that the PRO is the program operator. And so the program operator hasn't been picked, and the applications are coming up in January. So the workshop in September is for CalRecycle to describe to the public what's going to be in the application, what they expect in the process. And if anyone's interested in applying for this position, it's a good opportunity to make public comments or ask questions of CalRecycle. So with that, I'm going to hand it to our sponsor, to the Landbell Group, to give us a quick message as to why they want to engage with CPSC and specifically in the SB 707 implementation. Thank you, Pat.
Oh, thank you very much, Joanne. So I'm Pat Gibbs from Landbell Group. I'm in sunny Carlsbad, California, where I live. I'm managing our company's application process to be the single pro for the Producer Responsibility Organization for California SB 707, as Joanne just mentioned. We're at Landbell are absolutely delighted, really, to sponsor this webinar for this very important healthcare and hospitality industry stakeholders. We're sure you're going to find absolutely great value in it. We want to thank Dr. Joanne Brasch and her wonderful staff at the CPSC for putting it all together. It really took significant work, and we appreciate it very much, and I'm sure all of you on the call will. A bit about our company before we start. So Landbell Group supports companies and organizations worldwide with environmental and chemical compliance solutions. We are passionately proactive and involved in policy and advocacy on topics of waste management, circular economy, and extended producer responsibility. Our company was founded in Mainz, Germany in 1995, so we've had over 30 years to scale our operations and to really mature into a worldwide leader in EPR and in compliance initiatives. Our business model and our real charter mission is focused on promoting a circular economy globally and supporting EPR, which stimulates investment into infrastructure. I'd like you to take a look at our charter mission that's down there. We love it, we live it, and really it is the reason that we're in this business. Our experience in managing multi-waste stream PROs is hard to match. We manage 43 pros across the globe for multi-waste streams, which include textiles, e-waste, batteries, and packaging. We are one of the 4 selected Ontario pros for Blue Box end-of-life consumer packaging management in a system which collects from over 300 communities. We also have a very large chemical regulatory service division, which serves many satisfied customers around the world. And our customer base includes over 40,000 clients. We are a textiles pro in the Netherlands, so we have very rare direct market experience in managing a textile pro. And what we'd like to do is to bring that vast experience, our learned best practices, and our proven business model and our charter mission to the California Textiles Pro operation to ensure really the legislation's success and to promote really all of the variant stakeholder interests. Additionally, in our pro operation, we offer stakeholders what we refer to as a control tower support or a full circle support for all aspects of their variant EPR obligations, from audits, preparation to identifying and defining obligations and identifying responsible parties, and to managing correspondence and support on fees, including advice on even maximizing reduced fees for entities that are implementing initiatives that help achieve the interests of the legislation, to timely registration of the products that they put on market, to full support on data collection and submission of your annual reports. We're compliance experts on how to reduce risks, ensure sustainability, navigate very complex regulations, streamline operations, how to maximize resources for all of the various stakeholders that are contained within the pro operations. So that's a bit about our company. I want to really thank the CPSC for their comprehensive work on this seminar. Thank you all for attending, and thank you for listening and considering Landbell Group. I'll now switch it over to the CPSC to continue the presentation. Thank you again.
Thank you, Pat. And ultimately, when Landbell asked which market sector needed the most education on 707's implementation, I immediately said hospitality and healthcare. I think they're one of the market sectors that haven't been regulated for waste in a long time, but also have a lot of opportunities in this bill. So this is the timeline of the bill, and these are the milestones that are in the law. That means these milestones will not change. And one of the things to really call out is January 1, 2026. This is when the PROs, like Landbell Group, who are interested in applying, must submit their application to CalRecycle. There are other groups who are, also vocal about their interest in applying. So we won't know until January 1 which organizations submit, but CalRecycle must select one by March 1st, 2026. Part of the process of understanding how many pros will run the program, we look to past programs to kind of guide that decision. And ultimately, we did think that this was a market sector that would be ripe for multiple pros. But we heard from a lot of the stakeholders that one PRO for the first plan cycle and the first needs assessment would be really important to get the holistic, comprehensive landscape before allowing groups to break off. So don't worry, we'll talk a little bit more about the role of the pro and why a pro runs the program as opposed to a government entity. But before we do that, I also want to call out a few other things on this timeline. So one of them is March 1, 2027. That's when the first needs assessment must be submitted to CalRecycle. And the needs assessment is the first time that the selected pro does a full market research study. There are really key components that must be in the needs assessment, and that needs assessment will drive the plan and the budget. So that's why a lot of people ask, what are the fees going to be? Or what are performance metrics going to be? And ultimately, those details don't come until after the needs assessment and the statewide study takes place in 2027. The other two deadlines I want to call out is December 2029 and July 2030. These are the first dates. So 2029 is the first date we will see the submitted plan. That's the first time we will see the details of exactly how this program will operate. And CalRecycle, and so the pro has until 2030 to get CalRecycle to approve the plan. So one of the things we really encourage people who are new to EPR or new to understanding these types of programs, we like to say it's a really slow train ride and it's going to be really beautiful. And there's definitely no train wreck on the other side. But what we have is opportunity for engagement every step of the way. We have comment periods and publicly accessible meetings. So as these milestones are being met, every stakeholder has an opportunity to engage. So if you're just hearing about the bill now and you weren't aware of it while it was in the active legislation process, we still welcome you. It's not too late to get on board. There's still a lot of voices that need to be heard. And ultimately, because healthcare and hospitality are looped into this program, it is really important that advocates in those market sectors understand how they're affected and how they want to advocate for the best program for their market sectors. So part of the reason that we were successful in getting such a large piece of legislation passed was we spent years gearing up for the legislation by conducting pilots, gathering the evidence that the textile waste is a problem locally. And the timing of it all really worked out great because some of the global conversations happened at the same time. So the same years we were doing research on the textile waste in Los Angeles and the textile waste in the Bay Area, the mass media started picking up some of the images and conversations about the textile waste accumulating in secondhand markets like Atacama Desert in Chile and Accra, Ghana, and the connections to where the waste is accumulating relative to who's generating it. And ultimately, we know from the evidence gathered here in California that textile waste generation is massive. These are the volumes that are going to our landfill. We know that there were, in San Jose, they pulled about 3 tons of textiles in 48 hours for the study. And that's pulling it from the landfill line. In the city of Los Angeles, we're now starting our 3rd phase of the textile recovery pilot. And what we find is in certain parts of the city, 70% of the truckloads are textiles. So we know that there's opportunity, and we know that even within the healthcare and hospitality sector, we know that sheets and scrubs and pillows are part of these streams. So this June, after months of actually writing, CPSC is really honored to publish an article with the European Society for Medical Research. And ultimately, this article, we were contacted by ESMed saying they're putting out a journal specifically on medical textiles, and they're looking for some policy work. I think one of the hardest parts about writing this article is the audience is very clinical. And it has been over a decade since I worked with Erika in the hospital setting with doctors and nurses. So it was really fun for me to get back into that community and get back into that audience of why does it matter to clinicians? Why does it matter to hospital purchasing agents? Because those reasons are going to matter differently than the purchasing decisions that are made at large retailers or, mainstream fast fashion. We're talking about different problems, different decisions, but ultimately they're in the same program. So feel free to download it. It's also on our website. And we're really excited to see that so far it's been really well received. And so in the next few slides, we'll pull out some of the content of that article. First and foremost is which medical and hospitality products are part of the program, because not all of them are. I will want to make a note that this table is not exhaustive of the program. The program has a much longer list of products, covered products. What we did is we went through that list and said, which of those products are used in healthcare or hospitality? So uniforms are part of the program. Scrubs, they're regulated like uniforms. All of the housekeeping and environmental services uniforms, they're in the program. Sheets, pillowcases, linens, those are in the program. Pillows, actually one of my favorite projects at UC Davis Medical Center was on pillows. And one of the best things we found was even though pillows are recyclable, the switch to reusables was more cost effective. So pillows are in the program, and we'll talk a little bit later about when a product's in the program, what are we trying to accomplish? So as we start getting into some of the more protective equipment and protective clothing, those are not part of the program. So anything that is regulated under PPE rules or have certain level of performance requirements for either barrier protections or any type of safety protections as how they're regulated are not in the program. So PPE, surgical drapes, surgical gowns, hair bonnets, those are not in the program because they're regulated as protective equipment. Other things that are in healthcare settings like single-use wipes, diapers, and even reusable diaper type products like reusable underwear or the women's like reusable menstrual underwear, those are not in the program. And part of the reason, is for safety. We know that these products come into contact with biohazardous liquids and substrates. So we knew from the beginning, some are regulated and easy to dissect as these are not used in an everyday type of setting. So we exempted those products. But the last one I want to talk about that's exempted from the product is secondhand items. Because we know that if you're not paying the fee on secondhand items, we really want more consumption and more retail of secondhand items. So it was a way to use the covered products list to really expand reuse and expand secondhand retail because it's not part of the program. So then ultimately has fewer fees and fewer costs. So that's how we're really trying to drive a circular economy through reuse, repair, and ultimately cannot compromise safety. So one of some of the problems that are come up with, healthcare and hospitality textiles is We need these products for the essential operations of these facilities. You need sheets at a hotel. You need scrubs and kind of uniforms at a healthcare facility. There are a lot of reasons why these products will never go to zero, but there's a lot of opportunities to maybe shift the system into greener products, greener processes, and ultimately ensure that once they're no longer usable, that they're actually getting recycled. So we talk about there's a lot of costs for a health hospital or a hotel. If they want to start a textile recycling program, they have to find space. They have to find vendors. They have to create a new bin system and create staffing to empty those bins. And those are some of the big burdens on why some of these large generators don't end up having their own program. And so the whole point of SB 707 is have no fear, you don't have to do it on your own. SB 707 and the Textile EPR program will offer free access to the collection, sorting, and safe processing of textiles because it's paid by the producers, not the users of the items. So it's oftentimes where we have to take that moment to explain to the people purchasing the products in this audience, it's hotels, it's healthcare facilities, and let them know that just by buying the products, you're buying into the program. The cost of recycling will be built into the cost of the program, and ultimately, the words of the law will guarantee convenient access to the management of the unwanted textiles. So you've heard me kind of talk about a couple different parts of the bill. So it's a good time for me to kind of talk about which sections, how's the bill structured, and which sections are most relevant to healthcare and hospitality. And again, in our article, we go into a lot more detail. So obviously the definitions, you want to know who's in, who's out. The definition of repair is a really important one. The needs assessment, what's the scope of that research study and how is it submitted to CalRecycle for approval? The third most important section of the bill is in the plan. That's all the details of how the program operator will offer hotels and hospitals free collection, free sorting, and a guarantee that the materials that are collected are managed responsibly. And then the last two sections of the bills I think are the most important because this is how we know if the program's working is the annual report and the enforcement mechanisms. So daily fines up to $50,000 a day for brands and the pro that are non-compliant. There's a sales ban. If a brand does not comply, they cannot be sold in California. We also have a couple other mechanisms in enforcement, which is public disclosure of non-compliant producers. So a lot of times, this might not be as important for healthcare and hospitality since it's a much smaller market of producers. But I can tell you if Shein and Temu and the ultra fast fashion companies do not comply, that public disclosure of non-compliance will be probably our most important mechanism. And so when it comes to implementing this particular type of waste management policy in a heavily regulated environment like healthcare and hospitality, we had to balance a lot of issues. One, creating an equitable program. Right now, we have to, as it's written, uniforms and towels are going to be in the same program as glittery fast fashion, causing a lot of, pollution. So how do we create a program that is equitable for all the products and the different types of producers? And we do that through a couple different mechanisms, and one of them specifically is the eco-modulated fees. The other challenge is we want to make, a level playing field so that we can loop in the laggards who are not making recyclable products. They're not investing in, circularity. But we also don't want to stifle innovation. We want to let the leaders lead. And ultimately, like any policy, we want to avoid unintended consequences. So by taking the 3 to 5 years to prepare for the legislation, we met with the different associations, we met with different market stakeholders to really understand how they would be impacted and how we could design a program that worked for all the market sectors. And these are just examples of success. So if you go into the article, we have an entire discussion section where we talk about, well, what does success look like for healthcare and hospitality, specifically under this particular program? Because success is going to look different than success for fast fashion or success for other types of regulated products. So again, this is not a list that's exhaustive of all the things EPR can do. But this is a list of specific benefits that impact healthcare and hospitality, and ultimately relieves that cost burden to shift to circularity. You can still focus on focus on healthcare services, focus on providing a clean hotel, and leave the waste issues to the waste management sector. So it shifts that cost burden for each entity to figure out recycling on their own. It ultimately reduces the confusion of which is the greenest product that I can buy. Well, we will know through the eco-modulated fees, and we will know through the opportunity to see the different eco-modulated fees. And I'm not going to go through this ultimate list, the whole list, but there's a few things that I'm particularly really proud of. And one of it's the microfiber filtration. We haven't really talked about laundries yet, but laundries are a pivotal piece of the infrastructure for textile circularity. They're also a really big cornerstone of this program. So laundries are actually looped in as one of the largest beneficiaries of the program. They get funding for their services. They get funding to be a diversion opportunity so they can sort out the unwanted textiles. And the thing I'm most proud about is every commercial laundry who participates in the program will get free microfiber filtration funded by the industry. So if anyone's interested in microfiber filtration, you can know that California tried multiple times to regulate laundries, to add filtration. And it turns out instead of mandating it, if you incentivize it with funded filtration, you can set a global precedent. So we're really excited to again, all participating laundries will get free filtration so that we know that the more we use these laundries for reuse and repair, that we're not going to be having any extra unwanted impacts on our water supply. And then lastly, just to end on a very positive, is grants. EPR programs are built in with financial mechanisms to invest in any barriers to success. So grants and subsidies will be directly designed to invest in R&D, to invest in expansion of capacity, and to invest in the types of projects my next two speakers are going to talk about. So I know it's a lot, and I know we didn't cover everything that's in the bill. There are other resources, and we'll talk later after the two panelists about how to get involved in the implementation. So with that, I'm going to hand it over to Erika, and she's going to talk about some specific projects that she's been working on that will be interesting to the audience. Thank you, Erika.
Excellent. Thanks so much, Joanne. Can you hear me okay? Great. It is a pleasure to be here with you today. As you said, we've been talking about textiles and circular economy and extended producer responsibility for a few years now. And so I'm so thrilled to be here introducing this bill for our healthcare peers, as well as really providing an opportunity for healthcare to benefit from practicing this best-in-class EPR model that the state of California has. My name's Erika. I'm a nurse and the founder of KSH. You can go ahead and go to the next slide. Kimball Sustainable Healthcare is a sustainability consultancy for the healthcare sector. what makes us unique is that we leverage the mission, the culture, the workflows, as well as the quality standards of the healthcare sector to create sustainability programs that benefit not only the environment, but also really help hospitals meet their core operational goals. Go ahead to the next slide. Now, one core specialty of KSH is we specialize in creating a more sustainable healthcare supply chain. And we really do this, KSH really works across kind of these three big buckets, but how do you steer the big ship that is the healthcare supply chain and really make a more sustainable system? You really start at the sector level, and KSH is happy to kind of help create the conditions for industry transformation. And what does that look like? It looks like bills like SB 707 that really help align both suppliers and buyers in the market, as well as impact purchasing initiatives, things of that nature. We also work with hospital organizations inside of their own house to really set up the strategies, the governance structures, as well as the policies and standards to help take advantage of and participate in those industry initiatives. Last but not least, hospital sustainable supply chain, really core to that is a series of operational and sustainable clinical programs and best practices so that you're buying better materials and really using them for their full life cycle inside of the doors of your own facility. Okay, next slide. Healthcare, I am a zero waste healthcare gal, and I believe very much that healthcare can and should be a model for the circular economy. Healthcare has a lot of natural success factors for circularity, even though a lot of folks wouldn't necessarily think that they're a great first stop for such practices. Healthcare operates on a bit of a closed system. Materials that come in the doors are high quality. They're deployed under unmatched quality standards and really used by highly trained, mission-driven scientists. Those are all really good success factors for circularity. When healthcare implements circular practices inside of their institutions, what we really see are benefits that align closely with the goals of healthcare. Circular economy practices such as sustainable linen programs build a more resilient supply chain, really preventing critical shortages that we see in the news all the time, reduce the carbon footprint as well as the plastic footprint of healthcare supply chain. Of course, it saves money to reduce the cost of healthcare, and at the same time, it creates an engine for local jobs and economic well-being. This addresses the economic causes of health. Next slide. And so what is healthcare's opportunity for circularity? It's a big one. Hospitals generate about 5.9 million tons of waste a year. I think this is about 6 to 8% of the waste across the country. And so if you are in a community that is aiming for zero waste, the path to zero waste goes through your community hospitals. One thing that's really important, because when you say the words hospital and waste together, negative connotations come up. 85% of those materials go in the regular old solid waste system. And so those materials can and should be diverted through circular practices. And if we go ahead and click one more time, a study that KSH did a few years back with a hospital client, so we analyzed their landfill waste over 24 hours. And by weight, about 5% of what we saw was single-use or linens that either were lost through the system or single-use disposable plastic linen alternatives. And I'll show you a few pictures here in a few. Next slide. So how do we keep these items out of the landfill? 5% of the hospital waste stream is quite a bit. As Joanne said, SB 707 might feel like a slow-moving train, but I think everyone in the healthcare sector knows that hospitals are also, it's like steering a cruise ship and not a speedboat. And so it's time for us all to get on that slow-moving train now. And so what can hospitals do today? They can purchase better, they can optimize their utilization, and they can start sending more items to the laundry, knowing that with SB 707, we are going to see increased capacity for laundry and sterilization, repair, and as well as recycle at end of life cycle. Okay. So I have three case studies that demonstrate kind of these best practices that hospitals can deploy now, and really where the healthcare sector can now and in the future go to really get more items out of the garbage and into the linen system through circularity. So kind of looking at the animals in the zoo here, three buckets of materials. Number one is existing hospital linen systems. This is your patient linen as well as your uniforms, as Joanne was describing. And really, we have an opportunity to optimize and then grow this stream inside of our hospitals. The second is really, what are the items that are no-brainers that we could be taking out of our hospital garbage can today? And that includes items that are single-use disposable linens, not by material type, but just by design, where the economics, somehow we've kind of financial modeled ourselves into an equation where it makes sense to throw these things in the garbage instead of the laundry. We can stop that practice today. The third thing is, and what Joanne was alluding to, is really single-use disposable plastic alternatives. There's a lot of things to like inside of SB 707, but I think one thing to point out is that while these items are not regulated by SB 707, your PPE, your surgical drapes, what SB 707 does provide is an off-ramp for these materials, because by creating filtration resources, by creating increased processing capacity for healthcare clients, it really provides us a way to reduce avoidable single-use disposable plastics and really start addressing our plastic footprint. Okay, next slide. So kind of starting with category number one, I worked with a university-based health system and actually a team of university researchers. And I think this is maybe the last time that I think Joanne came and spoke to our class as part of these studies. But one thing that we did was really start to look at, before we start adding new items to the laundry, how much, how sustainable and how well is the existing laundry system working? And so if you have your existing general laundry system inside of your house, there really is an opportunity to optimize it in two ways. And I will say that we studied this linen system for a couple of years, and so there are a lot of findings here, but I'm going to zero in really on the path that reusable linen travels in the clinical environment. We studied first kind of purchasing data. How much laundry was the system using? How much laundry was the system buying and replacing? And we found some opportunities to optimize. The way that linen comes into a patient room, let's just go in a patient care area, is that clinical staff, frontline staff bring it into a patient room. That path of travel is a one-way direction, and that is so that we don't take any germs out of that patient room and back into the general environment. And so once linen has entered a patient room, kind of one thing is there's an opportunity to really be mindful about how much is coming in the door, because even if that linen goes through the system, what you find is that it's really easy to launder more linen than you're actually using in patient care. So that's opportunity number one. The second thing that we looked at was the replacement rate. And I know the slide says the linen replacement was 6% above average. It was actually 6%, which is pretty significantly above average. And so what we found is that this client was losing linen. Now, there's a lot of ways that a hospital can lose linen. I could rattle them off for you at another time, but we really zoomed in on clinical and operational practices. Again, what was happening inside the patient room. And what we found is that linen that was found to be damaged or heavily stained, at least 1 in 3 frontline staff had thrown away a piece of reusable linen over the past year. And the reason that they did that is because there wasn't a really great place to capture that damaged or stained linen. It was either going back into the soiled linen bin or there wasn't a place to pull it off the line. And so what was happening is it was being pulled off the line and into the garbage can. And so this isn't unique to this hospital. This is happening in hospitals across the country. And really, there's an opportunity for both process improvement as well as culture change. And so bills like SB 707 will do a lot of work to change the expectation that any damaged linen in the hospital ever belongs in a garbage can. And so these are operational practices that you can put in place today to, again, optimize your existing system so that it's ready to capture more linens upstream. Okay, next slide. The second class of linens that we'll talk about is a little pet peeve of mine. And these are perfectly good single-use, or these are perfectly good, cotton polyester linens that God knows I use these as my dinner towels for years because you just can't bear to see them go into the garbage can. But these are perfectly good linens that are designed and supplied to hospitals to go into a surgical area and then straight into the garbage can. And so we did a little back now with a hospital system. And what we found is that about 900,000 of these things were going through the system a year. This is not an outlier. And the way that this happens is that you might get 8 to 10 of these in a pre-packed surgical kit. And then maybe somebody brings in another 1 to 2 4-packs. And all of a sudden you've got 10 to 20 single-use disposable towels coming into a surgical area. Again, that one-way direction means that once it's opened, it's not coming back. And so it's either going home with a surgical team member who wants to reduce waste, or it's going straight to the garbage can. Now, there are opportunities right now to reduce this waste. One of the barriers to kind of doing away with this kind of no-brainer common sense solution, this is not a good practice. But there used to be sterilization shops for linen, and they kind of died off because people just started throwing more things in the garbage in the healthcare setting. And so the first thing that any hospital can do today is really look at this from a clinical best practice standpoint. Do we need 20 towels in this OR case? And really importantly, asking the question, which is, how do we keep these towels available in the surgical environment in case we need them without opening up so many and really creating materials that are destined for the garbage? This is a cost savings opportunity. We're really throwing money in the garbage at every hospital across the country. And so we'd be happy to chat further about this. The second thing is, to undo this practice, what do you need is sterilization capacity. And so because this services have died off, there's kind of 2 things to think about. One is, when you think about your sterilization capacity for a hospital, your sterilizers and your labors, to sterilize those materials may be spoken for. But if you think about this across your system, maybe there's a surgery center somewhere that's really not processing at full capacity. If every health system looks, we probably have untapped sterilization capacity in-house. Last but not least, there's a real opportunity here. What we're looking at is a way to rebuild local businesses as anchor institutions to grow the reuse economy. Together, 900,000 towels is a lot of business for a local sterilization business. And so what we can do is really pool demand in regional areas and start working with our laundry facility to create new sterilization resources. Okay, next slide. Last but not least is kind of that third category, which is single-use disposable plastics that are linen alternatives. And one thing that's really important is that there is a business case to take these materials off the line and really replace them with launderable alternatives. And so one thing that we did with a client was really analyze that business case, that environmental case. And we looked at a few very important things. In California, one, I think water is really important to look at when thinking about laundering more, as well as carbon footprint, costs, and operations. It's pretty straightforward once you see them side by side. There is a business case and there is an environmental case. And what it's tied to is that you really just need a fraction of the operating volume of launderable materials compared with the single-use disposable alternatives. And so because of that, you see more than 50% reduction in carbon footprint, a net lifetime water savings, as well as cost savings and operational neutrality. You're still moving the same volume of materials through the hospital every day. There is a difference in operations, but there's no net increase. Next slide. So the last thing that I want to talk about within this kind of isolation gown opportunity, we worked with a client to really test drive a sustainability scorecard. And so as we start to prepare for circular practices and circular economy growth in the textile sector, the products that we are buying as healthcare consumers are really important. And so one way to plan for circularity, as Joanne said, is to buy the best materials. We test drove a sustainability scorecard and really asked clients or asked our vendors for a few different things. One is, importantly, how many uses do you get out of each material? How much does it weigh? But really importantly, especially on the PPE side, is, are you using PFAS on your materials? And one thing that is important to note is that if you have single-use disposable or reusable PPE inside of your institution, there might be PFAS on those materials, but there doesn't have to be. Because we use this sustainability scorecard, we did find vendors that are phasing out PFAS in their textiles. And so that's something we can and should be asking our suppliers to do with us. The second thing is, in order for hospitals and buyers in this SB 707 environment to succeed, what we really need is transparency and comparability. And so that's where tools like this scorecard will really help to operationalize SB 707 inside of the healthcare sector. On the flip side of that, this isn't just good for healthcare buyers, this is good for healthcare suppliers. Everyone is working towards the same goal, and SB 707 is proof of that. Suppliers want to participate in the circular economy as well. And so both the scorecard as well as the policy really helps to get us all on the same page. Next slide. And so that brings me to my final point, which is I am thrilled that SB 707 is coming to market, and that for the first time, California hospitals have an opportunity to participate in these best-in-class circular economy models. As a healthcare sustainable policy developer, while a lot of the California Product Stewardship Council sponsored bills make exceptions for the healthcare sector, please know that I go shopping for policy language that is used inside of our client organizations, because they provide what is the CPSC provide. It is the best and the brightest in their fields who have come together to make collaborative bills and languages that work for everyone in your supply chain. And so for the first time, healthcare has an opportunity to really participate in these types of models. It's really a model that we should be internalizing in the sector at large. That's next slide. And so again, just in prep for this bill, it's time to look in your hospital garbage can, inside of your laundry system, to optimize your system, to integrate the policy elements in prep for the bill, and really just start building best practices inside of your institution, as well as the relationships with local suppliers and businesses so that we can grow new solutions. Thanks so much.
Thank you so much, Erika. Wonderful job. Next speaker, we have Scott Hamlin from LoopedWorks. Take it away, Scott.
Thanks, Joanne. Hello, everybody. I hope everybody's having a great day. I am going to start off a little bit and tell you about some of what happens at the end of life, and there might be some things that everybody could do to get prepared for SB 707 ahead of time that might provide some of the discounts that Patrick was mentioning in the overall fee structure. LoopedWorks is a textile circularity company. We're based just outside of Portland, Oregon, and Gresham, Oregon. Founded in 2009, I came out of the athletic and outdoor industry, saw too much waste, and had one of those existential crises, and decided that I would try and be part of the solution instead of part of the problem. Next slide, please. And go ahead and click through. These are progressive, Joanne. So what is the problem, I guess, is what's really kind of driving this, and part of it is overproduction, overconsumption, and underutilization of the things that we're making. So similar to what Erika was talking about, where we use things once and throw it away, we're just not really being mindful on the consumption side of things, the production side of things, and the quality side of things of manufacturing. What's resulting with this is on average in the United States, we have about a 27-year lifespan of all landfills throughout the country. One in Seattle, for example, is slated to close in the next 9 years. Miami has already ran out of space. And textiles are, depending on where you are in the US, between the third and the sixth largest amount of volume of materials going into landfill, and the fastest growing by about 30% year over year. So this is a main problem for the industry itself and for us as consumers. Next slide, please. So when we looked at it and I had that existential crisis, I said, hey, we can either be part of the problem, part of the solution. So what can we do today? And the idea and our North Star for the company was really, I'm gonna get specific to your industries with this example. How do we take a scrub and turn it back into a pair of scrubs at the end of life, or a towel and turn it back into a towel at the end of life? That was really our North Star, similar to what you can do with an aluminum can or a glass bottle or something like that. Back in 2009, there weren't a lot of technological solutions for doing that. So we started out by upcycling. And the reason that we started there was we wanted to learn the waste industry, and we wanted to be able to understand what we could do with it. And we knew that there was between 15 and 30% of all materials that would go into a manufacturing facility were coming out of the manufacturing facility without ever getting used, and then being either landfilled or incinerated. And to me, that was a huge travesty. And so we started by intercepting that post-industrial or pre-consumer waste. And then that eventually evolved into post-consumer waste as well. And we turned them into actual items, clothing and accessories that we resold. What this gave us was a really good firsthand look at how the supply chain works and how everything works within the larger organizations and brands. And as you can see from some of the examples on the screen, these are also outside of just fashion, outdoor, and athletic, but also into aviation and retail and a lot of different places. So textiles are very, very present in a lot of different places. And doing the upcycling work allowed us to kind of understand waste streams and how to do any sort of repurposing at scale. This initial footstep into upcycling also ended up with us doing repair and doing reuse and preparing things for re-commerce. So we really kind of saw the breadth of what was going on in the waste stream and how you might be able to give something a second life. SB 707 prioritizes reuse and resale. That is a really important thing that is crossed the policy itself, and we highly recommend it. Moving on to the next slide, please. This gave us an idea of how things like a Southwest Airlines seat turns into a high-end luxury bag, or an old NBA jersey from a player that got traded gets turned into another type of carry item. These are the types of products that we were making and commercializing. Next slide, please. But at the end of the day, we had our North Star, which was how do we take that set of scrubs, or how do we take that towel and turn it back into a set of scrubs or a towel? So we started working together with some of our brand partners that were on the upcycling side, and they came back to us and they said, hey, we love upcycling with you, but the problem is we only want to buy back about this much of our materials as products, and we have this much material. So what do we do with the rest of it? So we then proceeded with our North Star vision and started to design a circular system. And we went out first and took a bunch of our partners' materials and tested all the different types of recycling technologies that were out there, from old school, like almost 100-year-old technologies and mechanical recycling, all the way through to modern day chemical recycling and everything in between. And there was a lot of pros and cons to everything that we saw. And then we designed a system that came out of that would handle multiple material types with different technologies all under one roof, with the ability to recycle those back into beautiful spinning fiber that would go back in for the next generation of products. Or in certain cases, it would downcycle them into the non-woven market, which still has a very good long useful life of it if you're putting that into a home as insulation, or an automobile as insulation, or lots of different types of things. A lot of PPE is made from non-woven market materials. So this is the system that we created called the Loop system, patent pending system. And next slide, please. And this is a little bit of what we've built out. I just put a flash in here so that you can see there's a real live facility that is based right outside of Portland, Oregon, that is a large-scale facility that handles pre- and post-consumer access. We're processing today lots of different types of materials. We have worked with hospital industry here locally here in Oregon. We have some good experience with what the waste streams look like coming out of hospitals in Oregon, mostly coming directly from laundry, which seems to be the point where they're diverting between this can go back in the system, or this gets this has a landfill direction to it. And when we do that, the first thing that we're doing in our processing of these materials is getting them sorted and separated so that we can determine the highest value use of what those materials are. I see a question here real quick I'll take. Level of toxicity in the Loop system, the level is 0. We use very benign green chemistry in some of our fiber separation and decoloring, but outside of that, there's no chemicals whatsoever. Any water that we use is in a closed loop system that recovers about 98% of the water through the system and reuses it. So the DEQ seems to really like us because we're not doing anything from a harsh chemical standpoint. And our technology is a blend between a modern day twist on mechanical and some green chemistry that allows us to process all these different types of materials. Next slide, please. So the types of materials that we can process, it's pretty wide. We have kept it narrow. Currently, we're about 8.5 months into our operations here, and we're slowly starting to open up the different types of materials. But currently, we're doing cotton, polyester, cotton poly blends, and denim all back into full circular spinning fibers. Wool, acrylic, nylon, also full circular blending with light colors. And we do color matching to bring those back into a certain level of color requirements. The things we don't like in our system, we don't love high content elastane. So, you know, we're pretty good up to about 10%. You get over 10% and it becomes a problem for our system. Blends we can handle in our third phase with our fiber separation and decolorization. So that's fine for us. And then we also have some, downcycling opportunities on the footwear side, as well as accessories, bags, and hard goods, some of which we'll go into those downcycling methods, or others that will go into circularity. Next slide, please. So this is what our fiber looks like when it comes out from being processed. This is an example of cotton that we have. Basically, as things come out of our facility, they get bundled up and baled into fiber. The fiber then goes back to a spinning mill, which will then turn that back into a yarn. And then it gets moved into a knitting or weaving mill to be made into a material, and then into a cut and sew factory to be made into its final product. Next slide. And I'm going to leave it there at this point, but I think that some of the things I just want to leave you with is, thank you for providing context there, Bonnie. We are based here in Portland. We're open and processing now Joanne can give specifics on this, but I know there is a date and time within SB 707 that it's needed to be contracted with the solution provider to qualify for some of the discounts that are happening. And there's an opportunity to start to divert those things now. If anybody is interested in doing that, both from the hospitality and the hospital side, feel free to reach out and contact me.
Thank you, Scott. And for reference, he's talking about the eco-modulated fees, because any producer or even some of the generators who have established relationships do get a lower fee as a way to incentivize action sooner rather than later. We also have a question from Tony. Is there a way that someone can do more research on the process and the methods for your process?
That is a good question. You can obviously, I hate to say go to Google, because what's happening with this is that it's a lot of private companies that have a lot of IP that is set up. Some of the best places that I think you could probably go would be Textile Exchange, or the Higg Index has a material index that explains some of the different methodologies for recycling and what those look like. Those would probably be two of the first ones that I would recommend on it, in going and looking at different types of technologies and methodologies for recycling.
Thank you. We've got breaking news, everyone. Breaking news. Well, as I mentioned earlier, California has 14 EPR and stewardship programs, and one of them in particular, the mattress program, heard that we were going to be presenting to the hospitality and healthcare industries, and they said, we've been trying to get a hold of hospitals and healthcare for some time. So thank you so much. At the request of Bye Bye Mattress, which is our mattress program operator, they did ask CPSC to take a moment and tell our audience who has, influence and contacts in healthcare and hospitality, that this particular program, the mattress stewardship program, has a commercial volume generator program. So we want to encourage anyone on the webinar or anyone watching the video in the future, if your facility generates mattresses in your waste stream, please contact the stewardship program. They're here to help you. They have funding, and that's how EPR programs work. So again, we have the attention of an audience that another program's trying to contact. So if you work in healthcare and hospitality and you have mattresses in your waste stream, please contact the stewardship program operator. They're really interested in engaging specifically with large volume generators. I think before we kind of talk about getting involved, there were a few other questions that we kind of wanted to not just breeze over, but is conversion technology on the table as a viable solution? I will say from a regulatory standpoint, a lot of the technologies like waste to energy or incineration are off the table because of other laws. There are other attempts to reclassify things like pyrolysis as disposal. But in terms of specific types of technology, the bill is actually technology agnostic, with the exception of what's excluded. So there's a list in the bill pulled from SB 54, which is, like I said, waste to energy, incineration, and other types of non-viable solutions that have been deemed by other bills. So this particular bill didn't actually change the technologies that are allowable or not. I will say we did copy the definition of recycling from 54. So as the packaging EPR bill is rolling out, and how that program addresses chemical processing will influence how 707 will regulate chemical processing. Oh, James, thank you so much. I see a comment about mattresses. I hear the number of mattresses generated by hotels most often does not reach the threshold of the mattress program. Usually swapping out old for new and is incremental rather than an entire set. I think that's something that's really important in the advocacy process. So telling that specific challenge to MRC and the program operator will help them understand how they can design that part of the program. So maybe they need a contract with a consolidation point. Maybe they need to do a temporary, agreement for smaller bins for you to meet that minimum threshold. So just know that just because you're facing a challenge for accessing the program doesn't mean it's a barrier for entry. If you're having a challenge, we encourage you to work with the program operator. And if not, contact Cal Recycle, because if you have mattresses still going to the waste stream because of how the program's designed, Cal Recycle has authority and mechanisms to address that in the next plan or in the next annual report. So thank you so much, James. That's a really important component to talk about. And so we talked a lot about the different pilots. We kind of saw a couple questions in the chat and in the Q&A about where are we studying and where are these textiles going. And we really tried to get a vast different sources of generators that we studied. So we studied textiles coming out of the black bin, which is the landfill bin. We studied textiles coming out of the blue bin, which are people being aspirational, wish cycling, putting textiles in their blue bin. The biggest contamination and expense right now, but thanks, I guess, for trying. But ultimately, we're still designing pilots. And the pilots that we were doing before the bill passed were gathering evidence of the problem. What we see now is a shift. A lot of these pilots and a lot of the clients that come to CPSC are looking on how to shift their preparedness, how to pilot operations that get them experience and ahead of the curve for implementation. So please let us know if we can scope a project. We have a vast network and access to materials for any type of pilot, whether you're a hauler, a recycler, and one of our favorites are upcycling. So please let us know if you want to test any of your theories. We also have a task force, and one of the things we're really proud of is that it's free of charge. This is the task force that helped advise us and guide us through the legislative process. And we continue to host meetings, and we have working groups. So as we see the regulations come from Cal Recycle, hint, they're like 100-page documents. These working groups are designed for different sectors of the regulation to hold space for conversation. What does it mean? What do we want changed? So again, we have probably like 7 or 8 working groups. One of my favorite is the research one. So if anyone who's either in a research institution or working with students, that's a really fun working group. And there's still an opportunity to get involved. CPSC, we're not pay to play. So we have free newsletters and free listservs. We share a lot of information on our social media. And we always recommend that people go to Cal Recycle's website and join their listserv. Cal Recycle's announcements on their listservs are going to be the official program announcements. That's the best place to hear announcements of workshops, draft documents, and public comment periods. So with that, I'm going to take some questions and answers. I think we'll start with some of the ones that have been answered already, but we could talk about them verbally. And I'd like to start with the GHG and transportation question, because I think that's one that maybe, Scott and Pat can contribute to the conversation. So part of the question was, how will the program operator take into consideration GHG impact and transportation issues if we're shipping this waste all over the world? So I'll hand it to Scott first, and then I'm happy to chime in too on policy.
Yeah, absolutely. This was one of those in our research that we did about creating a system. We were concerned with a bunch of unintended consequences, and moving materials around was one of them. Part of our philosophy is that you need to process as close to the serviceable market as possible. However, we did some LCAs on just making a material like cotton or like cotton poly or like a polyester. And in general, depending on where it was made and how it was made, there's this range that kind of fits between 75 and 80% of the carbon footprint of whatever item was created from that material is actually emitted in the creation of that material, not in the cutting and the sewing and the shipping and the importing and the shipping again. So it's really the creation of the material. And if you look at our industry as a whole, it's built on oil and water, water to grow cotton and oil to make polyester. And so anytime we don't create a virgin version of those two, and we can use something that's recycled or keep it back in, maintain it in circulation, that offsets that need for the material itself, which reduces the overall carbon footprint.
Absolutely. And we also know right now in the market, like we don't have enough recyclers around the world to compared to the volume. Like everyone's at capacity, but at one point we're going to have more recyclers and hopefully, you know, less of a volume going into that stream. And so the program operator will at one point really need to pick, you know, and so we knew in the future when the program gets to that point, we cannot prescribe who and where gets the funding, right? That through multi-state commerce law, we were a little restricted on saying where these materials can go. But we did put a provision that says when the PRO is in a position where they're deciding, they must prioritize GHG impact and closer to the point of generation. So we can't make any recyclers open up in California and bring jobs here, but we can say at one point the PRO is going to have to prioritize, and those are the factors that are most important to at that point in time. So really exciting, really good question. And obviously we want to keep things as close to the point of generation and our circularity systems to really not have too much of an impact, knowing that, you know, it's not perfect right now, but there is a goal. I see a question about, this one's a new one that hasn't been answered, but David Stitzel coming out of Washington and working with Full Circle Environmental is working with a really great hospital laundry system. And one of the problems they're having is the large volumes of lint. And because it's flammable, you know, there are other safety issues. And I think those are the tiny little details that people don't always realize. And if a laundry is held to efficiency standards and held to disposal standards, you know, the PRO is going to have to help find a market for that lint. So my mind immediately went to schools making paper and how they used to make like craft paper, but I don't know if that's scalable. So I think that's one of those little details that needs to be part of your advocacy as we roll out the plan and as we develop the needs assessment to think about lint, because it is a byproduct of the process, and very interesting. Anyone else, any of the other panelists have anything to contribute on lint? All right.
It is a challenge. I will admit that one is a challenge, but there are, depending on the types of materials, there's some aggregate materials that it can go into, such as concrete, and a few other places like that on an industrial use standpoint. I see you've already kind of looked at fire starter, which is another place for it. But there are a few markets out there that can handle that type. Joanne paper is a great example of that as well. And felters, anybody that's doing needle punch as well.
Oh, needle punch, yeah. That's a great example. I'm going to go back to, there was a question from Andrea about the date, and I didn't want to misquote myself. I did need to go back, sorry, bear with me, to the timeline, because I want to make sure I don't misquote myself because they're in the law. So July 1st of 2026, all the producers must join the PRO, but the fees per unit do not get paid until after the plan is approved. So that would be July 1st, 2030, but they have 1 year to implement it. So I think it's 2031 is kind of like the earliest, I'll say the latest, the fees will be paid to the PRO. It's a really good question, and I wanted to make sure I had this slide up before I answered. This one's going to go to Erika. I answered in writing, but I think you could also add some clarity about contamination. What's the risk of contamination for used sheets? And how will the collection sorting system address the health risks?
This is a good question. So when you think about contamination in the healthcare sector or in the clinical environment, there's kind of a few different variables. There's something called universal precautions, and this is how we prevent patients from picking up infections in the hospital, protect our staff. And what universal precaution says is once a material is brought into, again, across the patient's threshold of the door into the surgical environment, what we assume then is that that material could be contaminated by germs, right? It's been brought into the environment. And so this is like a invisible but very real from a germ perspective contamination. And so what you do then is that kind of underpins that one-way direction of linen comes into the patient room and it leaves through the laundry bin. And so that's kind of contamination number one. And so where there is an opportunity right now is to provide within those boundaries, how do we make it easy to get linen that's either heavily soiled, heavily stained, or just looks damaged, shouldn't go back on the line? How do we pull it off the line without making the garbage can the obvious direction? The second part is contamination, just kind of you're thinking about a subset of the linen is just stuff that's just gross or, has biohazard contamination. It's not coming back. And so like in extreme situations, right, there is that biohazard bin if you feel like, if that is the place it needs to go. But really, the commercial laundry is designed to clean and maintain these materials. And so there's already a place for that laundry to go, and that's the soiled linen bin, and it goes back to the laundry facility. Now, where I think that there's the economics of throughput maybe kind of set up the system to move quickly. So I do think that damaged and stained linens kind of get through the system more so than they should. And so there really is an opportunity to invest more resources, maybe more technology to help capture those damaged linens in a way that builds kind of that economic, equitable environment for both the buyers of the linen as well as the laundry facilities. And so there is opportunity to improve there, but the system elements are already in place.
Thank you very much. Next question. Let me go back to the Q&A because the chat has kind of some smaller questions. There's a few questions about the microplastics and microfiltration, whether or not we could predict participation, or we could talk about the impact for non-hospitals and healthcare laundries. So microplastics are pretty interesting because when we wrote the bill, we kind of got the microplastics in two different areas. One of them is the provision that Alexis copied into the chat, which is the funding of the filtration systems. And then we also got it in, there's a provision that says the PRO has to come up with a strategy to address microplastics, green chemistry, compostability, and a couple other larger issues that were not easy for us to define. So we got in the bill a strategy, meaning they could have a working group, they could do some research. And that was, kind of the best we could get at the time. But interesting enough is in the bill, we reference DTSC's chemical of concern list. We reference it in the needs assessment, and we reference it in the plan. And that chemical of concern list in SB 707 says any of the chemicals that are on this list need to be managed by the PRO and really studied to understand how they impact circularity. So since 707 passed, DTSC is proposing to add microplastics to that chemical of concern list. If the microplastics are adopted to that list before the regulations are adopted for 707, there's a really good chance it's going to change the responsibility of 707 to really fund and address microplastics. So it's a good example of how one bill kind of works with existing statute to kind of elevate the expectations.
If I can add just one note there, you know, the healthcare sector right now, and really all of us in this field are looking at just the evidence of plastic pollution is growing by the day. It's a little overwhelming. I feel like I go through the stages of grief every day. But one clear solution that you know, is coming online is really to use less overall plastics and filter laundry to really prevent that microfiber from going into the water system. And just that is baked into SB 707. And so while hospitals are really, again, every day is a new adventure in this challenge, this is a very clear kind of action that we can start taking today to move more of our items to the laundry so that there is a filter, there is a way to send less overall plastics into the environment.
Absolutely. Thank you so much. And then last question in our final few minutes, which actually is a big question, is how the PRO is going to fund itself between the moment it's selected until the moment it can collect fees. And that's part of the application process, and showing in their application how they're going to fund themselves and how they're going to ensure fiduciary responsibility and equity in that gap. Because that's kind of the missing piece is, you know, there's still a lot of research that has to be done, but we've seen in other EPR programs it be done a couple different ways. We've seen loans be taken out that are paid back in the first few years of operations. We've seen a lag time of maybe they collect fees for a few months before they actually implement, so they can create some kind of money flow. And we've even seen some borrowing funds from other chapters or other types of branches if it's a PRO with multiple chapters or multiple operations. So it's not prescriptive on how they're funded until that fee, but how they design that mechanism is part of the competition. And I hope CalRecycle selects one that's based on equity and really making sure that it's fair for the different types of producers and the different types of products. So we will see, you know, in January once those applications are submitted. And we'll see once in March when CalRecycle selects the PRO, they're going to have to hit the ground running because they have really tight timelines. But we're really excited. And one of the other questions is, are there going to be more webinars and more workshops? And the answer is yes. As we mentioned, this slow train has a lot of information on it. So CPSC is committed to ongoing free webinars, free task force meetings, and ultimately our website and our listserv is there for all the resources you need. Our previous webinars are there, all of our research studies are there. And we want to invite everyone to connect with our panelists. This presentation in this webinar was carefully selected to make sure that the panelists offered case studies and solutions to those who are listening. And so I want to take a moment again to thank our sponsor and thank our panelists for participating. And I want to thank each and every one of you for listening to this webinar and engaging in the implementation process. So thank you and have a wonderful rest of your week. Thank you again. Have a great day.
Thanks so much,
everybody.
Joanne. Thanks, everybody. Take care.